Thank you very much, everyone, for being here, and I'm honored to be invited to talk to you here in Beijing. As Professor Cao said, I'm going to talk a little bit about what type of articles we published this past year. So Greg already mentioned the types of articles that we publish. I would just mention briefly. So basically, our main article type are reviews, but we also publish other long type articles as well as short articles. And then we also have these special features over the year, which are like focus issues, which are a monthly issue, which is on a special topic. And we also publish a series of articles on one particular area. So I'm going to highlight a couple of these special features. So the first one I will highlight is this focus issue that we published on hypertension in September. So as you know, hypertension is one of the major contributors to global cardiovascular morbidity and mortality. So we put together this focus issue with several articles that cover all the way from basic mechanisms to the management with different approaches. So, for example, in this first article, the authors focus on salt sensitivity of blood pressure, and they, in particular, discuss the mechanisms and the sex-based differences. So this salt sensitivity of blood pressure is defined as a clinically significant change in blood pressure that mirrors the dietary intake of salt. And for example, female individuals of any age are more salt sensitive than male individuals of the same age. And importantly, the risk of salt sensitivity of blood pressure increases after menopause. So some of the mechanisms for these sex-related differences, for example, are the sex hormones, the differences in renal transporters between female and male individuals, or the susceptibility to autoimmune disorders, which is higher in women. So the authors go through all these mechanisms that have been discovered both in animal models but also in humans, and highlight the point that it is really important to understand these differences for the management, because it will have implications for the management of women and men. They might require different drugs, for example. Another review that is included in this focus issue is about wearable blood pressure sensors. So as you are well aware, wearables are are advancing very fast, and they are very useful, for example, in blood pressure for early diagnosis and also for continuous monitoring. So the authors of this review explain the various mechanisms that you can use to measure biosignals, not only blood pressure, but also pulse rate and heart rhythm. And then they also give an overview of like the estimation methods that you can use, which will include AI, artificial intelligence algorithms. And they also go through all the pathways to improve the accuracy, because so far they are not as good as the usually blood pressure measurement done in the clinic. So I think this type of reviews is also very important to highlight what is the path forward. Another review, it focuses on the novel pharmacological approaches. So as we all know, despite all the current antihypertensive therapies, there is some proportion of patients who do not achieve blood pressure control. So discovering new therapeutics is very important to help these patients. So in this review, the authors go through some of the reasons for the poor control of hypertension, which can include genetic factors, lifestyle factors, or, for example, poor patient adherence. And as you can see in the figure, some of the novel targets that they discuss include endothelin receptor antagonists, new targets in the RAS pathway, or using low-dose combinations of current antihypertensives. Another way of approach to control blood pressure in individuals who don't achieve the blood pressure goal is renal denervation, which has been recently approved by the FDA to use in the US. So in this review, Fisher and Kirtain discuss what are the randomized clinical trials that led to this approval, and they also discuss how how to guide patient selection and implementation of this procedure. And finally, this focus issue also includes this different type of article, which is an expert recommendation article. In this particular case, the authors compare two guidelines that were released in 2023 and 2024 by European societies. And in the past, these two societies used to publish joint guidelines, but the latest ones, they publish separate ones. So these authors go through what are the differences and what are the commonalities in each guideline, with the aim of guiding clinicians in applying the guidelines for patient management. The second focus issue I want to highlight is this focus issue we published in October, which is focused on the metabolic alterations in heart failure. So as you are well aware, metabolic comorbidities are an important factor in heart failure development and progression. And this article, this focus issue, is focused mostly on the mechanistic aspects of it, covering different areas of metabolism, as you can see. For example, there is an article focusing on intermediary metabolism. So they describe how this intermediary metabolism is altered in heart failure, and particularly glucose and fatty acid metabolism. And then because it's altered, there are an accumulation of the metabolic intermediates, and this can lead to a lot of effects inside the cell. For example, post-translational modifications of proteins or epigenetics modifications, which in the end will lead to cardiac remodeling and alterations in cardiac structure. So they will describe also how some alternative fuels like ketone bodies or amino acids can compensate somehow for the altered metabolism of glucose and fatty acid. And they also highlight how these, like for example, novel cardiovascular drugs, which come from the diabetic and obesity fields, work in part through this intermediary metabolism. Another review focuses on the vascular dysfunction. So as we all know, coronary and systemic vascular dysfunction is both a cause of heart failure, but also heart failure can lead to further dysfunction of the vasculature. So the authors go through all the mechanisms for these effects, and they also describe how some pharmacological interventions and the surgical management can help improve the vascular function. Another very important aspect of metabolism and the role in heart failure is the immune system, which is called immunometabolism. So this is a crucial factor in heart failure. For example, the ischemia or the metabolic stress or the systemic inflammation that is induced by comorbidities can lead to a recruitment of innate and adaptive immune cells to the heart. But it can also lead to the activation of resident immune cells. And this can contribute to both the development but also the progression of heart failure. So, for example, if there is a metabolic shift in an immune cell from an oxidative phosphorylation phenotype to more glycolysis, this will lead to a pro-inflammatory activation of the immune cell. So the authors highlight how it is important to understand all these mechanisms, because maybe we can target these immune cells to kind of shift them back to an anti-inflammatory phenotype with new drugs. And finally, the fourth review in this focus issue focuses on the mechanoenergetic coupling and how this system is failing in heart failure. So it goes through the mechanics of the involvement of cardiac mechanics and mitochondrial energetics. And then when heart failure leads to the uncoupling, and then this then in the end can cause, for example, oxidative stress, which will in turn increase the cardiac remodeling and the dysfunction. So then the authors stress how important it is to understand the mechanisms of this mechanoenergetic uncoupling, because it can be targeted with current therapies, but also some emerging therapies that are in development. And now I will shift a bit and we'll highlight a couple of our ongoing series of articles. So we have this series of articles have their dedicated webpage in our journal. And then we just put together all the articles related to one topic. In this case, for example, is the epidemiology of cardiovascular disease. And our latest article in this series focuses in particular on the global syndemic of cardiovascular, liver, and metabolic diseases. So the authors use epidemiological data to illustrate the current and the future projections for the burden of these diseases, but also of the risk factors for these diseases. And then they want to propose a framework that integrates multi-system interventions for targeting all these diseases to address this important syndemic. I also want to highlight another series we have for a long time now, which is the prevention of cardiovascular disease. And our latest article was just published yesterday by Professor Chow and colleagues. And I won't go into much detail because I believe she will speak about it in the next talk. But basically, they focus on cardiovascular disease prevention in China, and then how to use artificial intelligence approaches to overcome the challenges and all the strategies for prevention. And then, as it was mentioned before, our journal covers a broad spectrum of cardiovascular research, all the way from basic translational approaches to the clinical. So I'm just going to highlight in my last two slides examples of first basic translational research papers. So we have here, for example, an article on post-translational acylation of proteins in cardiac hypertrophy, or mechanisms for the endogenous proliferation of cardiomyocytes, which is important to understand for the future development of regenerative therapies, for example. And then we have another article on extracellular matrix in vascular homeostasis and disease. This is particularly important, for example, for hypertension or for atherosclerosis. So if you understand the basic mechanisms, you maybe can find new targets for treatment in the future. And then finally, I want to highlight articles all the way to the clinical applications. So these are two types of articles that we publish: expert recommendations and consensus statements. So an example of this year's expert recommendation is focused on redefining respiratory sinus arrhythmia as respiratory heart rate variability. Sometimes a name is important in how we see and treat the disease, so these authors wanted to highlight this in this expert recommendation. And then we also have this consensus statement, which is focused on the use of artificial intelligence for coronary CT angiography evaluation. Thank you very much all for listening, and I highlighted here again the link for the proposals for Journal Club and tools of the trade. You can also scan the QR code, and thank you very much, and if you have any questions, I will be happy to answer.